Each year, emergency departments across the U.S. treat about 750,000 children with concussions.
Most of them will get better in a couple of weeks, but some will have lasting symptoms. As CBS 2's Dr. Max Gomez reports, there's a new test that can predict who's going to have prolonged symptoms. Doctor?
That's right, Maurice. You know, not only are persistent concussion symptoms troubling for kids wanting to get back to school and sports, the temptation to ignore some of those signs when they've been around for a while can be dangerous. Go back before the brain is healed, and you risk serious damage. Johnny Coburn is back on the ice after being sidelined with a concussion.
It was a really bad headache, just really bad.
I knew that the severity of the concussion was much greater than that 5 days or 7 days of rest would fix.
More than half of children treated at emergency departments end up with headaches after a concussion.
Parents usually ask, how long is my son or daughter going to have symptoms, and what's going to go on after that, and what do I have to do? There's no good way to actually predict those that are going to go on to have persistent symptoms.
But new research is designed to help predict which children are at higher risk for developing persistent symptoms after concussion. Canadian researchers evaluated just over 3,000 patients ages 5 to 18. About 30% ended up with persistent post-concussion symptoms at 28 days. The study in JAMA, Journal of the American Medical Association, looked at 46 possible signs for concussion.
After they evaluated those 46 variables, they came up with 9 variables that were fairly predictive of post-concussive symptoms.
I want you to just follow my finger, just with your eyes, okay?
The clinical variables were used in a 12-point risk score. They included things like age, sex, history of migraines or depression, prior history of concussion, and problems with balance.
It's variables that we would normally capture in the emergency department, but now it's compiled into one decision rule.
Meanwhile, Johnny's headaches are gone and he's feeling much better. Now, while this new scoring system is available now, researchers say further research is needed to show how good it really is at predicting lasting concussion symptoms. And for now, the only real treatment for a concussion is total brain rest. No TV, no sports, video games, and even no school or homework, believe it or not.
Wow.
Until those symptoms all go away.
Yes.
Brain rest.
Yeah, thank you, Dr. Max.
Thank you. Well,